Hi everyone. This PowerPoint presentation will give you information about the changes that occur in a woman during pregnancy. Most of the changes occur because of an increase of female hormones, primarily estrogen and progesterone. As you can see on the first slide, HCG is one of the first hormones on board during the pregnancy. It peaks at around 12 weeks, the beginning of the second trimester, and gradually decreases over the next 10 weeks or so. It's the hormone responsible for the nausea and vomiting of morning sickness. It helps to stimulate the production of estrogen and progesterone produced by the corpus luteum until the placenta is well developed and can do this at around 12 weeks. That's why the nausea and vomiting decreases at this point. HCG is also the hormone that turns the pregnancy test positive. Check out the drop-down notes below the slide to see exactly what effect estrogen and progesterone have on a woman's pregnant body. The most obvious reproductive change that a woman can see is the change in the breasts. Look at the slide and see how the breast, nipple, and areola get larger. The nipple and areola also get darker in color. The other reproductive changes are not seen by the woman. The cervix gets a bluish tint to it. That's called the Chadwick sign. Chadwick color. The cervix gets softer, noted on the palpation, and this is referred to as the Goodall sign. It's good and soft. The McDonald sign is when the isthmus of the uterus becomes soft and flexible, such that you can bend the fundus on top of the cervix, like the golden arches of McDonald's. A mucus plug also develops in the cervix, but this is not visible even on exam. The woman may complain of excessive vaginal discharge, and this is due to the effect of hormones, not the release of the mucus plug. In early pregnancy, the woman may have urinary frequency because the uterus is pushing on the bladder. Her skin may itch, her lips may bleed. She may develop hemorrhoids as the uterus gets bigger and puts pressure on the veins in the lower part of the body. She can also get varicose veins on the vulva, vagina, and lower extremities. She may complain of constipation as organs are displaced. She may complain of heartburn as the uterus grows, pushing on the stomach and pushing GI content up through the sphincter. The endocrine system affects many organs in the body. As it relates to pregnancy and reproduction, the anterior pituitary gland affects the ovaries and the production of FSH and LH. It also secretes prolactin, which is responsible for milk production. The posterior pituitary gland releases oxytocin, which helps with uterine contractions after delivery and stimulates the letdown reflex. The thyroid gland has an effect on the pituitary gland and so has an effect on all these hormones. As the uterus gets larger and pushes on the diaphragm, the ribs flare, the substernal angle widens, and the chest circumference increases. This allows for adequate ventilation. Total blood volume increases by about 45%. The expanded blood volume increases cardiac output but does not increase blood pressure. In fact, blood pressure decreases until about 24 weeks gestation, then gradually returns to the pre-pregnant level by term. Plasma volume increases by 40 to 60%, whereas red blood cell volume increases by 20 to 30%. This greater increase in plasma compared to the red blood cells results in what's called physiologic anemia. Here you can see how the aorta and the inferior vena cava are compressed with the gravid uterus. Therefore, it's very important that the woman not lie on her back during pregnancy and that she lay on the right or left side. Let's look at some skin changes. There are many skin changes during pregnancy, and most will completely go away or significantly fade. This includes chloasma on the face, linea nigra on the abdomen, which is a line that goes from the symphysis pubis up to the umbilicus and sometimes above, striae on the abdomen and breasts, and increase in varicose veins, especially spider veins, and the presence of new moles. The palms and soles of the feet may be red. Two good things is that the nails get stronger and the hair seems thicker because less is falling out on a daily basis and hair is growing faster. Knowing what causes the changes in the pregnant body and how they occur will help you to gain a better understanding of the common complaints of pregnancy. Most, if not all, of these are common and not alarming to the nurse. The nurse needs to educate the patient about the common effects of pregnancy and reassure her and her partner. For some of them, she will need to give her helpful hints for dealing with these common complaints.